We are done with the physiological factors which determine flexibility, speed, endurance. Okay, now we did the effects of exercise on cardiovascular system, then effects of exercise on muscular system, and before that, in that video, sports and medicine, please check out in the playlist. I had also done the sports injuries, the starting part, the soft tissue injuries, that is contusion, strain, sprain, abrasion, and bruise. And today we are going to start with bone injuries. Okay, so there are the following types of bone injuries: simple fractures, compound fractures, complicated fractures, green streak fracture, comminuted fracture, and impacted fracture. First is simple fracture. The fracture without any wound, where the bone is broken at one place, is called as a simple fracture. So basically, when bone breaks at one place, okay, without any wound or anything, then we call it as a simple fracture. Compound fracture is that fracture in which skin and muscles are damaged along with the fracture. Broken bones comes out of the skin by tearing it. Okay, so all those people who are non-medical, they must be going like, eek. Okay, so compound fracture is that fracture in which skin and muscles both are damaged and the bone, it comes out of the skin. Okay, so then comes complicated fracture. In complicated fracture, a bone is broken and damages the internal organs. The internal organ may be tissue, nerve, or artery. Usually such type of fracture are complicated and dangerous because they have actually like injured the internal organ, right? And they are common in high jump and pole vault. Okay, now green stick fractures. These fractures are commonly seen in children because their bones are very soft and delicate. Whenever there is any stress on the bone, it is bent. Okay, now comminuted fracture. When a bone is broken into 3 or more pieces, it is called as comminuted fracture. Such type of fracture is possible in cycle race or motorcycle race. Now impacted fracture. When the end of fractured bone enters into another bone, then it is called as an impacted fracture. Okay, so how many types of fracture? 6 types of fracture. What are the 6 types of fracture? First is the simple fracture. What is a simple fracture? No wound, nothing, only at one place a bone is broken. Okay, then we call it as simple fracture. Then comes compound fracture. What is compound fracture? In compound fracture, the bone along with the muscles and skin is broken, such in which the skin and muscles are also damaged, and the bone sometimes comes out of the skin, okay, or plunges out of the skin. Third one is complicated fracture. What is complicated fracture? It is one of the most dangerous ones, wherein a broken bone damages the internal organs. Okay, it is really dangerous. It might even be emergency case. It usually happens in high jump and pole vault. Then comes green stick fracture. Green stick fracture is when a bone bends. It usually happens in children because they have very soft and delicate bones. Then the fifth one is comminuted fracture. When a bone is broken into more than 3 pieces, we call it as comminuted fracture. And what is the final one? Impacted fracture. When one bone enters the other bone, then we call it as impacted fracture. Causes of a fracture. Fracture usually occurs due to high impact on the bone. It can be, just a second. Okay, so fracture usually occurs due to high impact on the bone. It can be caused by overuse. The most common causes of fracture are given below: sports event where there is a high impact, traumatic, forceful, unnatural movements, prolonged long distance walking or running, okay, sudden fall on hard surface, direct strike or hit with any solid sports equipment, and osteoporosis. What are the causes of fracture? Osteoporosis, where sport events with high impact, traumatic, forceful, unnatural movements. Okay, unnatural movements are the most in sports history. Okay, you don't know, your hand should move like this, it's like that, and then suddenly the bone breaks. Prolonged long distance walking or running, sudden fall on hard surface. Prevention, they should do warm up, okay, they should do proper conditioning. We all saw this, okay. Players should not continue to play during the state of fatigue. Good officiating can prevent fractures. Players should be very careful and alert during practice and competition. Sports equipment should be of good quality. Scientific knowledge is essential. Protective equipment should always be worn, and balanced diet should be taken so that deficiency of vitamin D is not there, and bone density is also good, okay. Training and competition area should be clear of hazards. Now we come to joint injuries. Joint injuries, dislocation of joints is the main injury. Dislocation of joints can occur in contact sports such as football and hockey. In the sports that may involve falls such as downhill skiing, wrestling, gymnastic, volleyball. Hard blow to joint, a fall, forceful throwing, lifting, hitting may also cause dislocation. Dislocation of lower jaw, it occurs when the chin strikes any other object forcefully, okay. Usually in boxing, dislocation of lower jaw occurs. Dislocation of shoulder joint is the most common one, okay. Dislocated shoulder, you must have heard. Dislocation of shoulder joint may occur due to sudden jerk or a fall on hard surface. End of humerus comes out of the socket, okay. And in fact, when your shoulder dislocates, strong force such as a sudden blow on your shoulder pulls the bones in your shoulder out of place. Extreme rotation of shoulder joint can pop the ball of upper arm out of the shoulder socket. There can be partial dislocation when upper arm bone is partially and in and partially out of the shoulder socket, that is partial dislocation. Dislocation of hip joint, putting maximum strength spontaneously may cause dislocation of hip joint. The end of femur is displaced from socket. Dislocation of wrist, a sports person who performs in a sport or game which he may fall run the risk of getting dislocated. Miscalculated leading also cause dislocated wrist. Generally occurs to a person who uses his hand to break his fall, okay. So never use your hand to break your fall. Whenever you are falling, the moment you put your hand, it will dislocate, okay. Wrist dislocation are common in various sports such as football, ice sport, hockey, skating. Prevention, adequate warm up, proper conditioning, stretching, should be careful, alert, protective equipment should always be worn, avoid falls and hits as far as possible, proper physical fitness, regular exercise, obey the rules and regulations, play according to the game. All these things are there. Now, causes of sports injuries: improper conditioning, improper, so all the prevention and precautions opposite is only going to be the causes, okay. Improper conditioning, okay, if there is not proper conditioning, then most maximum amount of injuries can happen. Improper warming up, if you have not warmed up, you directly start playing the game. Unscientific way of training, okay. If the athlete player who performs training in an unscientific way, that is doesn't have proper knowledge, doesn't get good coach, who can teach the right way, okay, any way they are teaching. Then lack of fitness, it does not mean physical fitness but physiological and psychological too, okay. Then nutritional inadequacy, lack of proper nutrients, then lack of sports facilities, injudicious officiating, no use of protective equipment, practice during the stage of fatigue. If you are fatigued, you should not practice, otherwise you'll get injured. Pressure of competition, carelessness during the game, recurrence of injury, and improper sports equipment, overuse of muscles. Prevention in sports injuries. Okay, that was prevention for bones. This is prevention in sports injuries. Use protective, have a balanced diet, do proper conditioning, proper warming up, proper knowledge, listen to the officiator, unbiased officiating, proper sports facilities, use protective equipment, don't overstrain, do not proper cool down, obey the rules, use proper technique. Tips for preventing: avoid training when you are tired, increase your consumption of carbohydrates, increase your training. In training should be matched with your increase in resting. Never practice hard. If you're from previous stop, if you experience pain during training, stop your training session immediately. Use appropriate training surfaces. Introduce new activities gradually. Allow a lot of time for warming up and cool down. Check overtraining competition courses beforehand. Be extremely fussy about hygiene in hot weather. Monitor daily signs for fatigue, Aim for maximum comfort when traveling. Okay. Now, treatment of soft tissue injuries. Abrasion. Abrasion occurs due to friction. We just saw treatment: clean the affected part with fresh water, pick out the dead tissue, gravel, debris, everything. Okay, because it's like a scrap, right? Use clean as well as sterile gauze to wipe the dirt off. Then dry the area. After that, apply medicinal ointment so that proliferation of bacteria does not take place. Use enough ointment. It does. So that it does not stick to the abrasion. Use a big piece of gauze for dressing, then visit the doctor for proper dressing and a tetanus injection. Tetanus injection is very, very necessary. Apart from this video and the chapter also, I'll tell you like I know there are some people who, you know, they did not take tetanus injection, and after falling, you know, you never know, like yes, it is not that common over here. Yes, you live in a good residential area or whatever, but still it may happen. So please, like they had recurrent fever and then infection, and then it escalated to some other level. So please, and then the dressing should be changed as per instructions of the doctor. This is for abrasion. Then for contusion, cold compression should be used immediately. Ice or cold water should not be used for more than 40 minutes. Okay, it should be performed 5 to 6 times. If there is more swelling, anti-inflammatory should be there. Okay. Then laceration. What is laceration? Laceration is an irregular cut in the skin from a sharp object or a sharp edged sports equipment. These wounds are more dangerous than the incised wounds. Such wounds are not smooth. Bleeding is less from such wounds. These wounds may be very poisonous. Usually rough marks remain even after treatment. So laceration is an irregular cut in the skin from a sharp object or sharp edged sports equipment, and they are more dangerous because they are not smooth, and bleeding is less from these wounds. They may be very poisonous. Okay, so first of all, you need to control the bleeding. After that, put pressure directly, holding it above the level of heart for 15 minutes. Then if you're unable to stop, try to use pressure points. Once the bleeding has stopped, wash the laceration with warm water. Assess and see if it requires stitches. If the person requires stitches, then take them to a doctor. For simple lacerations which do not require stitches, use antiseptic ointment. Cover laceration, okay, watch for infection and change it regularly. Take painkiller if the pain persists. Then incision also occurs to sharp objects. Sometimes arteries or veins may be cut. Blood usually comes out freely from incisions. Treatment of incision: if the wound is not that deep, then let the blood come out so that the germs will also come out, because you know it went inside, right? And then after placing a piece of cotton on the wound, bandage should be applied. Okay, the bandage should be kept tight. The wound is too deep, doctor should be consulted immediately. Then sprain. In sprain, first is price procedure. Price procedure should be followed for the first 28 to 48 hours after the injury. Price stands for protection, rest, ice compression, elevation. Okay, so first protection, by wearing shoes which support, okay, such as lace ups. Then rest, please don't exert it more. Stay in your bed, avoid moving too much. Then ice, and then compression, okay, swelling as well as bleeding. It is best applied using a firm pad over the site. Okay, compression should not be applied around the whole limb. Elevation, if possible, elevated. Mice procedure. Mice is for mobilization, ice compression, elevation. Mobilization, taking injured part through its full range of movement, should be avoided, which cause pain. This will prevent wasting of the muscles through lack of use. Okay, so first mobilization should be done, then ice, and then mice. Now, so compression, elevation, and this is price and mice. Protection, rest, ice, compression, elevation. Mice is mobilization, ice, compression, elevation. Okay, now strain. Complete muscle is ruptured, or else treatment for strain is price procedure is there, and then Yeah, price is only there. Then treatment of bone and joint injuries, dislocation of lower jaw, shoulder, hip joint. Treatment for dislocation, call medical help immediately. Don't try to remove the joint or place it back in the socket, please. It's not you need a professional for that. Keep ice on spot to control the swelling. Sling or splint the affected joint into fixed position. Now fracture, stress fracture, elevate extremity and rest while the bone heals itself. Apply ice to the affected area. If there is any need for immobilization, use a splint. Green stick fracture, most of these involve arms and legs which require immobilization to make the bone grow back together in a proper natural position. Pain can be relieved by taking painkillers. Commuted fractures into many pieces, uh, then it is not easy because many pieces have happened. So plasters and splints, and for pain management painkiller should be there. It is a long thing, okay. It may take more than a few months. Then transverse fracture, if the injury is limited to a break of transverse process with no other. Transverse fracture, it is break of one of the bones of the spine as or a part of it, okay. Break of one of the bones of the spine. If the injury is limited to break of a transverse process with no other injury, hospital care is not necessary. Thoracic spine. Medication for pain control, limit the various activities. Multiple fractures of backbone, damage to spinal cord may require operation. It can pain and stiffness for weeks. Complete rest should be given. Oblique bone fracture, when bone is broken diagonally in the axis of the bones. Mostly these fractures occur at humerus or femur bones. It depends on amount of damage. If the damage is minimum, plaster can be used. Surgical treatment is required in most of them. Even rods and screws can be there in severe ones. Impacted fracture, when one bone enters the other bone. If it is not too severe, splint may be sufficient. Only involve a few bone fragment. Immobilization may be enough to treat it. Minimize. They take more time to heal. Surgery is also required in severe cases. First aid. Every individual's life and work are closely related to his environment. Man has progressed in various fields. First aid at first help is given to the wounded or accidental victim before the arrival of the doctor. It is immediate temporary care given to a victim of an accident or a sudden illness before the services of a physician is obtained. First aid is that aid which is provided to the injured in case of an accident, injury, or sudden illness. Area of field of sports and games, injured is very common. Any player can be injured in the training, practice, or competition. Therefore, first aid firstly. The teacher of health and physical education also have enough knowledge of first aid. Okay. Aims and objectives of first aid: to preserve life, to preserve or to save life of the victim, of the wounded or the wounded. Okay, there are limitations to first aid, but even then every possible effort should be made. To alleviate pain and suffering. Pain is natural in any type of accident. Therefore, major objective is to reduce the unbearable pain, prevent condition from worsening. Okay, so if the does not get the doctor, then so soon enough, then prevent the condition from worsening till the doctor is there. Okay, to promote recovery, start the process of recovery as early as possible. To procure early medical aid. To procure early medical aid is one of the most important objectives of the first aid. Um, However, the first aider should pay attention to provide first aid to victim of the wounded person, but effort should also be made to seek medical aid as early as possible. All right, so let's go through all this once, okay, properly. Physiology and sports for strength, okay. For to determine strength, we need factors which determine strength are size of the muscle. Bigger the muscle, more is the strength. Body weight, more the body weight, more the strength. Muscle composition, that is white twitch fibers, okay, more muscle strength. Intensity of nerve impulse, that is the faster and the more the excited the nerve impulses are, okay, the motor units are, then stronger are, then the more the strength will be there. Determining speed would be, first is mobility of nervous system, okay, then that is rapid contraction relaxation, then muscle composition, again the wide twitch fibers, then flexibility, that is for thorough movement, and explosive strength. Explosive strength depends on muscle contraction, muscle composition, and muscle coordination, okay. So basically both contraction and muscle coordination can be improved, but muscle composition is genetic. Again, white twitch fibers only comes. Then biochemical reserves and metabolic power, that is ATP and CP, adenosine triphosphate, and there is a phosphagen adenosine triphosphate, and creatine phosphate, okay. They both should be enough, okay. If it's less, then we need to give supplements. Now for endurance, there's aerobic capacity, okay. Aerobic capacity, that is the amount of oxygen supply while we do the endurance performance, we take in and give it to our muscles so that energy is liberated. It is dependent on oxygen intake, oxygen transport, oxygen uptake, and energy reserves. Then the second one comes as lactic acid tolerance, that is how much we are able to bear, that is the highest concentration and during an endurance activity. Then movement economy, special technique we need to use for endurance so that maximum we can do, okay, for longer period of time. Then muscle composition, that is slow twitch fibers play an important role over here. Then comes flexibility. Flexibility is dependent on muscle strength. Higher the muscle strength, more we can tear through the gravity, okay, and more flexible we are. Joint structure, that is some joints have greater motion, therefore the ball and socket joint has the greatest range of motion. So joint structure also, it depends on age and gender. We know as we grow older, the as we grow older and older and older, then our flexibility decreases, therefore we need to enhance it. Then stretchability of muscles should be easily stretchable. Internal environment also, 10 minutes outside in the sun, and we can and we are sweating and we are flexible, but in winter season where there's extreme cold, okay, we cannot. Then previous injuries, if to connective tissue, then fibrous tissue is formed around the connective tissue, which reduces flexibility. Now cardiovascular system effects, that is by doing exercises, cardiovascular respiratory exercises, cardiorespiratory exercises, not cardiovascular. Anyways, it increases the size of heart, that is the muscles become more stronger and increase in size and strength of the heart, okay, of beating strength. Then decrease in resting heart rate, that is the resting heart rate, which is 72 beats per minute, can also become 10 beats per minute, okay. Then stroke volume also increases, that is the stroke volume at rest 50 to 70 for untrained individual, it is 70 to 90 and 90 to 110 also sometimes. Increase in cardiac output, the cardiac output increases 14 to 20 liters per minute. If minute is for people who are not trained, 25 to 35 liters for trained individuals, and for expert even 40 liters of blood per minute, that is output is there. Increased blood flow, the blood flow is also increased, that is existing capillaries open wider and therefore blood distribution becomes more efficient. With regular exercise, person's capacity may reach up to 5500 cc, and then increase in maximum oxygen uptake, that is VO2 levels also increase. Effects of exercise on muscular strength, that is the shape and size of muscle increases, formation of more capillaries, muscle remains in tone position, controls the extra fat, that is it gets that is reduces extra fat, and Okay, change in connective tissue, efficiency in the movement of muscles, it delays fatigue and increases food storage, exercise and its health benefits, non-functioning fibers also become active, body posture remains correct and improves reaction time. Again, let's go through muscular system, that is change and shape in the size of muscle, increased food storage, muscles remain at tone position, controls the excess fat, the connective change in connective tissue, the non-active fibers also become active, delays fatigue, the body posture remains correct and improves the reaction time. Now, sports injuries, there are three types of sports injuries: soft tissue injury, bone injury, and joint injury. Soft tissue injury are of six types: contusion, strain, sprain, abrasion, and bruise. Contusion is when the blood vessels in the muscle they break. Okay, and strain is when is a muscle injury, that is the entire muscle can be ruptured or a part of muscle can be ruptured. Sprain is a ligament injury, that is the ligament due to can be overstretched or teared. Abrasion is when multiple layers of skin due to friction they come off. Then then comes, after abrasion then comes bruise. Okay, bruise is, oh, bruise is not there over here. Okay, bruise was basically when blood used to get collected in an area. Anyways, bone injuries, simple fracture when only bone breaks, okay, at one place. Compound fracture, skin muscles also get damaged and it may come out of the skin. Complicated fracture, it hurts the internal organ. Green stick fracture, the bone bends, it usually happens in children. Comminuted fracture, the bone breaks into many pieces. Impacted fracture, one bone enters the other bone. Okay, now, joint injuries, that is dislocation of joints, is the main injury. Okay, so dislocation of lower jaw can take place. Okay, when strike the object very forcefully. Dislocation of shoulder joint can take place due to sudden jerk when you fall hard on hard surface. Um Okay, the end of humerus comes out of the socket. Partial dislocation of shoulder, only a part can partially in and out also. Dislocation of hip joint, it comes out of the end of femur comes out of the displaced from the hip joint. And then displaced wrist, that is miscalculated landing or fall can lead to dislocation of wrist. Prevention, again, proper conditioning, adequate warm-up, stretching, all those things, careful alert, always wear protective equipment. Causes, again, improper of all this. And then prevention of sports injuries, again, proper warming up, conditioning, balance right, use of proper technique, obey rules, all that. Then tips to prevent, okay, tips: avoid training when you are tired, when you are fatigued, do not train. Increase consumption of carbohydrates during period of heavy training. Increase the resting time along with the training time. Aim for maximum comfort when traveling. Stay away from infectious areas. Be extremely fussy about hygiene. Monitor daily for signs of fatigue. If you are in doubt, then cool off. Allow a lot of cooling time. Warm up. uh, if you experience pain, stop your training session immediately. Pay attention to hydration, nutrition. Okay, use appropriate training surfaces. Then treatment, okay, for abrasion, clean the part, okay, and fresh water, dead tissue, pick out the dead tissue, and then debris and everything, clean it with sterile gauze, put an ointment on it, then do the dressing, and then take a tetanus injection. Then contusion, again, it is a muscle injury. Okay, direct hit can cause a contusion, it is a minor accident. It may sometimes even result as a bruise. Okay, so treatment of contusion, again, cold compression 5 to 6 times, anti-inflammatory, and painkiller can also be given. Laceration, it is irregular cut in the skin from sharp object. Okay, it may be even poisonous, so control the bleeding before anything else. Apply pressure, okay, the level of heart for 15 minutes, like hold it. Okay, then bleeding has stopped, then warm water, mild soap, bleeding starts again, then repeat the step 1. See if the laceration requires stitches. Take the person to the hospital if stitches is there. Otherwise, use antiseptic ointment, cover it, wrap it with gauze, watch infection, dressing regularly, take painkiller. Then incision when sharp objects or equipment spikes and all, they arteries or veins may also get cut. Then if it is not too deep, then let the blood come out and let the germs also, and then put a piece of cotton and bandage should be applied. In case of excessive bleeding, bandage should be kept tight. If it is too deep, then go to the doctor immediately. Sprain, ligament injury, overstretching or tearing of ligament. Okay, do the price and mice, two procedures. Price is protection, that is protect the injured area from further by using support shoes and all. Protection, then rest, then ice, then compression, and then elevation. Mice is mobilization, that is do the mobile movements, not those through which you find pain, but others, so that to check if the muscle is active or not and make it stay active. Then ice, then compression, and then elevation. Strain is muscle injury, mild as well as severe. Sometimes complete muscle is ruptured, sometimes a part of it. Severe pain can be there. Treatment, that is price only. Okay, protect the injured area, then rest, then ice, then compression, and then elevation. Reduce as well as bleeding. Okay, strap it. Okay, dislocation of joint, uh, dislocation of shoulder. For dislocation, all three kinds of dislocation, call medical help immediately. Do not try to put it back in the socket or move or do anything. Keep ice and sling or splint it. Okay, for fractures, most common one, that is stress fracture, that is a crack in the bone. It will heal automatically. Immobilization, apply heat on it, give some painkillers, 6 to 8 weeks. Okay, avoid activity. Green stick fracture, immobilization, they grow back together. Bone bends backwards and cracks itself, breaking completely into two pieces. All right. Pain can be relieved by taking pain relievers. A removable splint is the most recommended. Okay, then comminuted fracture, bone is treated more pieces. Then it needs a lot of time because many bones have been broken. Okay, so plasters and splints and everything is needed. Transverse fracture, that is break in the bones of the spine. Okay, so injury, hospital care is not necessary. Okay, if there is no other injury, medication and everything can take control, but and for some weeks there will be pain and stiffness, but exercise should be done to strengthen. But if intricate fractures have been happened, then the spinal cord may also be affected, and in that case you need to do surgery. Oblique bone, when the bone is broken diagonally. Okay, so most of these require surgery. The damage is minimum than plaster, but most require surgery. Impacted, when one bone impacts the other bone. um, if an impacted is only involved few bone, then immobilization. Other, in some cases, surgery is also required. First aid always help. Aim and objective of first aid: first, preserve life in any way, then alleviate the pain and suffering, prevent the condition from worsening in case doctor, hospital, whatever, traffic and all, promote recovery, and then procure early medical aid.